What is a sternoclavicular joint dislocation, or SC joint dislocation of the shoulder, and what do you do about it? I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on all sorts of sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. I've recorded a couple Ask Dr. Geyer videos on SC dislocations or sternoclavicular joint dislocations, but I want to record sort of an overall sort of a summary or introductory video about these injuries because I think there's a lot of confusion about this injury. The sternoclavicular joint is this joint right here we call it a shoulder injury because the collarbone part goes up to attach to your shoulder, but it's almost more of a chest injury. It's this joint where the collarbone meets the sternum or your breastbone. Now, you can dislocate this joint typically with a traumatic mechanism. I get people that send me questions periodically that say they've never had a traumatic injury, but it pops in and out of place. Maybe they have lax ligaments, that type of thing. But what we want to talk about specifically is the much more common traumatic sternoclavicular joint dislocation. There's a number of ways that you can injure this joint. You can get hit directly on the front of the chest, which would push the collarbone, the clavicle, behind the sternum, a posterior sternoclavicular dislocation, which is probably the less common mechanism, or you can get hit on the front of your shoulder or get your arm pulled in such a way that that collarbone pops anterior or in front of the sternum or the breastbone, an anterior SC dislocation. All right. Typically, let's start with the more common anterior sternoclavicular joint dislocations. If the collarbone pops out anteriorly, you see a big prominence there, and yeah, it can be uncomfortable at first. Typically, though, that discomfort goes away with rest, and the weakness from the overall injury can get better with the rest and time and doing a little bit of work with a physical therapist. No, we typically don't try to pop them back into place because they don't typically stay. Very, very often they'll pop right back out. So we typically leave them alone as orthopedic surgeons. Yes, if you read the comments in my Ask Dr. Geyer videos, you'll see tons of people that are frustrated with the prominence that they see there, although it's fairly subtle once the swelling and all goes down, but typically we're not terribly successful popping that back in and it just staying in place, so we typically don't need to do that. I've had a ton of high-level athletes, even football players with anterior sternoclavicular joint dislocations that have gotten back to sports with no problems down the road other than maybe they see a little bit of a bump there, but no pain, no weakness, no limitations at all. So typically that's the treatment. Now, a posterior dislocation where the collarbone is pushed behind the sternum is a little bit more of an issue because there's bad structures behind your sternum or behind your breastbone. There's the aorta or branches of big arteries off the heart. There's the airway essentially in the esophagus, all kind of in that area. So that's an area where we will try to pop it back into place. Typically that's done in the operating room so that you can have a thoracic surgeon available just in case there's, you somehow, popping it back into place causes some sort of arterial injury or something like that. Sometimes it actually needs a surgery to open it up and pop it back into place, sometimes even putting a graft or a tendon to basically reconstruct the ligaments that are torn. That's not terribly common, but sometimes that's indicated, again, for posterior dislocations. The other time surgery sometimes can be performed is if it constantly keeps popping in and out of place after a traumatic event. There are surgeries where you can basically weave a tendon through drill holes and reconstruct the ligaments that are torn in the initial injury. Now, those surgeries are not without risk because, again, all those really bad structures are right behind the sternum. So we try to see if we can get people better without surgery, and then we know those risks exist. So, you have a thoracic surgeon available on backup, and it's a big ordeal. There aren't all that many orthopedic surgeons, even in the sports medicine world, that do those surgeries. I used to do those surgeries, but the hospital where I work now doesn't have a thoracic surgeon, so I couldn't even do them if I wanted to. But there are people in different parts of the country that do those surgeries. Fortunately, though, one, the injury is fairly rare, and two, most people don't need surgery. Okay, have you suffered a sternoclavicular joint dislocation or SC joint dislocation? How did you get over it? Did the surgeon pop it back into place, or did they just give it time and physical therapy? Or did you have surgery for it? I'd love to hear your experience, and honestly, I think viewers all around the world would love to read it as well. So below this video, share your comments, share your experience so we can learn how you got over it. If you like videos like this and you want more information on sports and exercise injuries, injury treatments, and injury prevention, I record up to 3, sometimes more of these videos every single week. So subscribe to my video channel. Click the subscribe button in the upper right corner of this page. Like I said, record several of these videos every week. They'll get delivered directly to you. Thank you so much for watching. If you know somebody dealing with a sternoclavicular joint injury, please share this video with them so that hopefully it can help them. And I look forward to seeing you right here next time.